First of all, what is anxiety? Anxiety is a natural response to stress or perceived threats, but it becomes problematic when it's excessive, persistent, and interferes with your daily life. Common symptoms of anxiety include physical symptoms. You might notice increased heart rate, muscle tension, dizziness, or nausea. Cognitively, you could experience excessive worry, difficulty concentrating, or intrusive thoughts. Behaviorally, you might start avoiding situations, feeling restless, or engaging in compulsive behaviors. Moreover, anxiety can show up in various forms: generalized anxiety disorder, social anxiety disorder, panic disorder, and phobias. From a cognitive behavioral perspective, anxiety is maintained by catastrophic thinking, overestimating danger and underestimating your ability to cope, by intolerance to uncertainty, and also by oversensitivity to physical symptoms. Plus, avoidance behaviors reinforce anxiety by preventing you from learning that feared situations aren't as intolerably dangerous as they seem. CBT focuses on challenging these unhelpful thoughts and gradually exposing you to your fears in a controlled way to desensitize them. On the other hand, from a Freudian or psychoanalytic perspective, anxiety serves as a signal that unacceptable thoughts or impulses are trying to surface, leading to defense mechanisms like repression, displacement, or projection. So, how does CBT treat anxiety? First, by identifying negative automatic thoughts, those habitual, irrational thoughts that trigger anxiety. For example, let's say you're invited to a social event. Your automatic thought might be, "I'll embarrass myself and everyone will think I'm awkward." Next, we need to recognize cognitive distortions in these automatic thoughts. Common cognitive distortions in anxiety include catastrophizing, jumping to baseless catastrophic predictions, mind reading, assuming you know what others think about you, and fortune-telling, predicting failure without evidence. All three distortions are present in our example. I'll embarrass myself and everyone will think I'm awkward. Challenging these automatic thoughts is key. Next, there's exposure therapy, facing fears gradually. Avoidance fuels anxiety, so CBT uses graded exposure, where you gradually confront a feared situation in a manageable way. Behavioral experiments in CBT encourage you to test your fears through real-life experiments. And finally, relaxation and mindfulness techniques, including diaphragmatic breathing, progressive muscle relaxation, and mindfulness, are applied to manage anxiety. To sum up, by identifying negative thought patterns, challenging cognitive distortions, and gradually facing fears, you can break the vicious cycle of anxiety and regain control over your life. Thanks for tuning in.